When you have symptoms or suspicions about your health, do you start your diagnosis by clicking on Google? Should you? Time for our national checkup. We started this panel in March and it was a quick hit. We're lucky to have a pool of healthcare professionals to help us, and tonight we introduce you to even more of its members. Dr. Samir Sinha is the Director of Geriatrics at Toronto's Mount Sinai Hospital. Dr. Danielle Martin is back with us. She's the Vice President of Medical Affairs at Women's College in Toronto. Shalom Globerman is President of Patients Canada. And Dr. Vivek Rao is the Head of Cardiovascular Surgery at the Peter Munk Centre in Toronto. Their thoughts in a moment, but first, some basics. Deep into the internet age, you may be one who goes online to search out medical help. And if you are not alone.
I often refer to Google as a second opinion for medical advice.
Yes, I have used Google for medical advice.
An Ipsos survey last year showed 55% of Canadians had gone online to help make their medical judgments. That's higher than the global result. It was 48%. Breaking those numbers down is even more revealing. 2/3 of the women polled had gone online, 1/2 of men. Almost 60% of those under 35 had done so. And here's a key point. A Leger poll in 2011 tested the trust factor, and online medical advice scored high. 2/3 of those surveyed said they trusted Dr. Internet. Should they? Just how much faith in online medicine is too much faith? That's one of the questions for tonight, but so is this: wait times.
It's hard to get in to see a doctor. You're waiting sometimes 2-3 weeks. It is very slow.
Sometimes the long wait is just very, very stressful.
Is there a way around the average 28-hour wait for a hospital bed? In a country where millions end up in hospital beds every year, that wait remains a critical issue. Enough with the questions. Let's get some answers. All right, well, it's clear that a lot of people going online looking for medical advice. What's not clear is a good thing or a bad thing. Danielle?
Well, I think it's a completely understandable thing. I mean, we're all online looking for information about everything else. And actually, this has been studied, and it turns out Dr. Google is not a bad diagnostician. But I think that what comes after you hit in that search box is what you really need to think about. People need to consider the source when they're clicking on the hits that come up after Google. So university-affiliated sites, research center-affiliated sites tend to be more reliable. And it's important to remember that anybody can buy a domain name with an illness in it. And so you have to utilize some common sense and a grain of salt when you're looking at a website. Try to figure out where the funding is coming from for that site before you believe everything you read.
Samir?
I agree with that, and I build on that by saying I think it's really good to have, for experienced clinicians, but also for patients who are engaged and may have an illness or a condition. I often recommend to my patients, talk to me about what you're interested in. If you want to learn about your health or learn about your diagnosis, it's just as Danielle said. I will recommend that they go to those websites that are more trustworthy and supported, because otherwise, if someone was clicking online, they're looking at a sore throat. Many of those same symptoms are those of throat cancer as well. And so if you don't actually have some guidance, you can sometimes land in a dangerous place that can sometimes leave you more worried than actually well.
I guess that's the key. What do you do with what you're seeing online? Viv, what's your view on this?
I think it's great, and I echo exactly what the previous panelists have said. I can tell you, and I'm not ashamed to say, that some of our residents and trainees often Google right in the wards themselves to come up with a diagnosis. I think information itself is a very powerful thing. The question is, how do you rate the information and how do you evaluate it? And that's where you come to your trusted professionals. And seeing a doctor and having the doctor interpret that is what's the most key, I think, for most patients.
So it's not about cutting you guys out of a job. It's actually supplementing.
Absolutely. And it's a two-way street. There's very often I will go to a patient and say, here's the information. If you want to read up more on this or your options or about this procedure, here's the website to go to. Here it's online, and you can see exactly. I think my colleagues here will share there's two types of patients that I see. One that want to know everything and one that don't want to know anything at all. And they're saying, you're the doctor. You tell me what I need to have done, and I trust you. And unfortunately, I'd rather the former patient who wants to know everything about it, because I think the well-informed patient is the best to take charge of their own health care.
Shalom, what about patients generally?
Well,
What's your
patients
view?
can also get a lot of information from other patients. So if a patient is about to have knee surgery or hip surgery, then knowing what the experience is like and being able to tell someone else about it is really valuable. Learning from other patients turns out also to be a very good thing. So patients can teach patients about various situations, admissions, about what weights, about which doctor they see, and so on. So a lot of patient-to-patient information is very, very valuable.
And I think you can find that online.
And you can find that online.
There are other services beyond checking for what you might be, having a problem with, and that is, sort of Rate My MD, Rate My Hospital. Where's everybody on that one? I mean, those are sites that people use. Viv, what do you think of that?
I know I'm on Rate My MD, and several of my patients have done that. The problem with those types of sites...
Just what do you mean you're on Rate?
Well, my
People
patients...
can look at you.
People can look at me and see what other patients have said about me. I think that for most of the physicians on those types of sites, you get two types of patients who blog. One who were ecstatic with their service, and those that were not so happy. And you don't get the average. I think you get the two extremes of opinions. And that's why I don't think it's the most accurate place to go to.
Yeah, we know all about that in this business. You sure hear from the extremes either side. What about the patients?
Well, I think the same thing is true. I mean, when you see those sites, you never get one view. You get both views. And I think that rating doctors using that isn't that accurate. It's really your own experience and the extent to which a lot of the comments are about doctors' ability to communicate, and that's a two-way street. So if the patient can learn to communicate better, then the doctor usually is better at communicating. But also, doctors have to learn how to communicate better in order to be able to deal with the patient side.
Danielle?
Yeah, I mean, I think this is a very emerging science, the science of trying to rate quality, communication, whether you're looking at hospitals, whether you're looking at individual providers. And I think we're going to need to go there because people want that information. And so the question is, how can we build better ways of providing it to people, ways that are somewhat more reliable? How can we provide people with actual information about the quality of care that's received and not just impressionistic kind of encounter-based stuff? And I think that we're only just beginning to see glimmers of what that could potentially look like in the future. And, ideally, it would include some mix of people's stories about their experiences, because those matter, but also some hard science to kind of back that up in terms of outcomes. And I think ideally we would be able to provide people with both.
All right. Samira, I want you to help us with this. We're going to move it to this whole issue of second opinion, because clearly there's a lot of concern out there about what to do, when to go for a second opinion, and how to go for it, where to go. Here's some of the comments we heard from people who are in that situation.
No, I wouldn't know how to get a second opinion, no.
I suppose if I knew how to do it, I might have asked for a second opinion earlier.
I can't even get a first medical opinion half the time.
All right, that's a problem. But second opinion, generally, how do you do it? How do you make that decision, and who do you go to?
I often think, second opinion or the thought about a second opinion is one, that often should be made between a clinician and their patient first. Because I think sometimes when people are looking for second opinions, it mainly can be, as Shalom was saying before, due to communication issues. Sometimes a patient might feel, has my doctor thought about this? Or have they considered that diagnosis? And if they didn't ask that question, or if their doctor didn't mention that, then someone might feel that hasn't been mentioned. So often when I hear people are asking for second opinions, for example, it's really about, have you asked your clinician about that? Because I have patients who ask me for advice about, how should I go about doing that? And I often say, have you even asked that question? Sometimes they haven't. I also think it's the other aspect is, often when you talk to your clinician, clinicians often get second opinions. I'll often say to my patients in certain circumstances, I'm not 100% sure if I'm the right person to deal with this. I might bring in my colleague, to get this. And sometimes there are other ways of doing it. As opposed to having my patients travel to see different people, I might actually go and talk to my colleagues and let them know about that. And I think through good communication, I think that's the way to approach it.
Well, that would be a key, good communication. I'm just wondering how many doctors are willing to say, I'm not 100% sure when they make that diagnosis. But Viv, where are you on it?
I agree, and you heard from the panelists. I think part of the problem is you find it so difficult to get your first opinion that once you're there in that office, the last thing you think about is second-guessing what you're hearing. But I think
Unless it's really difficult news you're hearing.
But I think there's
Then
two
you may want a
situations.
second opinion.
Absolutely. I think a patient who's in the office, if they get the news that they want to hear, I don't need surgery or, I'm going to be fine, then they're fine with that. If you get the news you don't want to hear, you're not a surgical candidate or there's no cure for this, I think that's when you need to ask, can I get a second opinion to see if someone else concurs with this? The problem that I've seen as well is that people get third, fourth, fifth opinions when all the answers are the same. And, where do you draw the line saying this is your fifth opinion? The previous four have all confirmed the same thing. Do we draw the line somewhere?
Shulman?
I did a bit of research on this. It turns out that there are studies done about asking for second opinion and getting second opinion. And Canada is among the worst of the developed world of either getting or receiving second opinion. And I think a lot of it is cultural. I think that Canadians are afraid to upset the doctor. I think that they say a lot of please, thank you, I'm sorry. I think that there's a lot of that going on. I also
Could
think
there also be a lot of I trust my doctor?
a lot of I trust my doctor too, which is good. I think that all of that is good. But I think the question about how you do that again has to do with how well people understand what's going on and how well they're prepared to do it. I think that the way to get a second opinion is to go back to your primary care doctor and find another specialist. I think that bit of information is really important for people to know.
All right, Danielle, I want you to cover this next one for us, because this is probably the most common thing we've heard over the last decade, at least, and that's how do I get through the system? I keep getting trapped with waiting times. Here are some of the comments we heard.
I find it's very drawn out and takes a while to actually see a doctor.
Why the long wait list for much needed medical care?
How do you fix this problem?
How do you fix this problem? Wait times, it just seems to always be there.
So interestingly, in Canada, we don't actually do too badly. In fact, we do quite well in terms of outcomes for urgent or emergent medical care. So I think that's the first thing that we need to acknowledge. When people are really sick in Canada, by and large, the system tends to deliver. Where I see problems with wait times and where I think many Canadians experience them is when we're waiting for things that are not urgent or emergent, but that can have a really significant effect on our quality of life. And that's when people find that they're waiting what feels like too long for a specialist appointment or a diagnostic test. Oftentimes, it's actually not so much about a lack of resources. It's not that we don't have enough doctors or we don't have enough hospitals or we don't have enough machines. It's that we're not doing a very good job of managing the resources that we have in order to have our supply meet our demand in the moment when we need it. And a lot of that has to do with just the basic way that we manage wait times in the system. So we know what needs to be done a lot of the time, but it's not such an easy system to turn around quickly.
Shulman?
I think that a lot of wait times for surgery are set by doctors, not by patients. That it's the doctor who puts you on the list, not the patient. The patient that can't get on the list by themselves. So for those things, it really has to do with how doctors manage their practices. I think that that's a big part of it. I also think that our system is structured to the urgent. The Canadian healthcare system is about hospitals and doctors and not about very much else. And I think that getting wait times changed is really providing other kinds of services that people can go to. So if they have long-term conditions, they don't have to necessarily go to the doctor or the emergency room or the hospital. There are other places to go to, like community services that provide home care and so on. We don't have very much of that. We don't have enough of it, and we don't have access to it. And the consequence is that everything goes to the emergency room or goes to the hospital. And we don't want that. I mean, we have to change that.
All right, Samir, I've got to take a break, but quickly on this wait times issue.
I think the key is if someone's worried about, I feel I need to be seen sooner, I think it's always, again, good to communicate with your primary clinician, because if your symptoms have changed and your situation's become more urgent, that's as clinicians how we tend to manage our wait lists. I always look at the severity of a case, and I say, if that person calls my office tomorrow and it's something that needs to be seen urgently, we make it happen. And I think that's where Daniel says we tend to deliver in that way, but communicate why you think you need to be seen sooner.
All right, we're going to take that break I was talking about. But when we come back, this question: how does Canada's healthcare system really stack up with its international competition? And welcome back to our national checkup. At the table tonight, doctors Samir Sinha, Danielle Martin, and Vivek Rao, along with patients' rights activist Shulman Globerman. All right, this is tip time. I want your number one tip about how Canadians get more out of their medical care. Let's start with you, Samir.
ask questions, read about your healthcare, stay engaged.
3 tips, all good. Daniel.
One tip for me would be to take the time and invest the energy to develop a real relationship with your family doctor or primary care provider. That's what's going to see you through the decades to come.
Do you find that that happens?
Sometimes it does, but other times I find, there's no other 40-year relationship in your life that isn't going to have some rough patches, right? And so I think that to take that long view in your relationship, both the physician and the patient actually need to do that. And when it's not working or there's a bad day or there's a communication mishap, to be able to actually talk that through and figure out a way forward is critical. And I find that sometimes it's too easy for patients to just walk away, and then you lose that continuity, that knowledge that it can be such a powerful tool for healing.
Sean, number 1 tip.
Don't go alone. That if something serious is going on, go with somebody else. Go with your family member or a friend so that both of you hear what's said, and then you can talk about it afterwards and make sure you've understood it.
Yeah, because that can be critical, right?
Yeah.
That you leave and you don't really understand.
And if you're in hospital, don't go alone.
Viv?
Well, the motto I say to my patients is own your health. No one else cares about it other than you. So it's your right to challenge what you've been told, to research and get yourself educated on your particular health condition. And I completely agree with Shalom. Go with someone else. So for 2 pairs of ears hearing what the doctors are saying to you. Own your health.
We like as Canadians to think that we actually have one of the best healthcare systems in the world. And others talk about us that way. Some talk about us not that way. But is it as good as we tend to think it is, Viv?
Well, I wouldn't be where I was if I didn't think I was in the best place in the world to do what I do. So, people, if you ask around the world, they say, what's one of the top 5 cardiac centers in the country or in the world? Peter Mount Cardiac Center comes up there. Sick Children's is universally recognized as one of the top 5 pediatric places in the world. Princess Margaret's the top cancer center in the world. We tend to get complacent about that, and we tend to take it for granted that we have these centers of excellence in our backyards. But yes, we stack up very well on any benchmark you care to choose in these areas.
Sean?
We're terrific at hospitals and hospital care and surgery and all the leading edge things. We're not very good at taking care of people with multiple chronic conditions. We're not very good at providing care for people who have difficulty accessing the system, people who are poor, people who don't speak English as their first language, people who are very old, and so on. So that's where we don't rate very well. And we're quite right. At that level, we're terrific. And at other levels, we're not so good. And we're at the back of the pack in some of them.
All right. Quickly, Danielle.
Sure, strengths and weaknesses. To me, the area where we stack up very poorly is in access to prescription medications. We know we are the only developed country with universal health insurance that doesn't cover prescription medications. And so we have huge problems with patients ending up in the emergency department or admitted to hospital because they can't afford to take their medicine. So while we do tremendously well in some areas, there are others like that where there's a lot of work that needs to be done.
Samir, you get the last word.
Yeah, no, I think, one of the reasons I came back from the United States to Canada is because this is a great place to practice, practice medicine. And I know we compare the US and we live longer, and so we hold our laurels. But when you actually look at the best performing countries in the world, better than Canada, mainly in Europe, it's about those countries that have really invested in medication coverage, in good primary and community care systems, including home care. That's where we need to really build next.
All right. Thank you all. Good discussion. Thank you. And thanks to you as well. Lots more on our website from our health unit. Check it out at cbcnews.ca.